When our insurance ran out, we needed help.
I had to work, but the pain just kept getting worse every day.
My baby was sick, and I didn't know what to do.
For more than a decade, St. Mary's Health Clinics have provided free medical care for those with nowhere else to turn.
I'm going to check your temperature.
Volunteers at clinics throughout the Minneapolis-St. Paul metro area offer preventative care and treatment for patients with everything from common colds to serious medical conditions.
Okay, well, you're doing really good.
A critical safety net for the uninsured, the clinics help people get well now so they can avoid more dangerous, costly medical problems in the future.
The people that have ongoing problems and really don't have good access to care will get worse. Okay, we'll take a peek in there.
An extensive network of volunteers, including doctors, nurses, social workers, interpreters, and others, come together to help those in need. Donated space from churches, schools, and other organizations is used to set up clinics and reach out to a diverse group of patients.
We're out in the communities where people live. That's where we serve patients, so they can find us.
We came in October 1999.
One of these people is Abdallah Ibrahim. Several years ago, he came to Minnesota from war-torn Sudan with dreams of a better, safer life for his family. But within months of settling into his new home, he became ill.
I had pain in my shoulders, always. Pain in my shoulders and headache, and sometimes, a pain in the chest.
But getting help would be a challenge.
I was a part-time worker. We didn't have any insurance.
Faced with a choice between providing for his family and getting medical care, Abdallah let his condition worsen until he heard about St. Mary's Health Clinics.
Hi, Mr. Ibrahim.
Hello, Doctor. How's it going?
Good, thanks. How are you today? Have you had any chest pain?
Doctors at St. Mary's Health Clinics were able to give Abdallah the help he needed.
They told me I have very high blood pressure, and they gave me the medicine.
Now, Abdallah is feeling better. He gets the medical treatment, prescription drugs, and information he needs to stay healthy.
I'm just going to have you turn your head a little bit toward me.
Thanks to St. Mary's Health Clinics, Abdallah finds the promise of a healthier future for himself and his family, a future that includes new hope and some new friends.
I've missed you. I haven't seen you for a while.
Oh, yeah.
You've got to come back.
Yeah. Every time you come, you feel just like you are with your family. And when you are leaving, you are just like saying goodbye to my family members.
What's this?
With a joyful smile and boundless energy, 3-year-old Takara is like many children. But when she was just a year old, her mother, Tara, noticed something wrong.
The breathing's heavy, and she, just sounds like she's always just out of breath. At first they said, well, it's just the cold, and then it continued, and finally they diagnosed her with asthma. Do you want to push the button?
Medical assistants paid for the treatments that kept Takara's asthma under control. But just after her daughter's 2nd birthday, Tara got some bad news.
I went to pick up her prescription. It was $330 for a 1-month supply. And I said, well, I have insurance. And they said, no, your insurance, was cut a month ago.
Because of her mother's income, Takara was no longer eligible for medical assistance.
I didn't know what I was going to do, and I didn't know how I was ever going to afford this medication, because every turn that I took, I was just getting shot down.
Finally, through a phone call, she found St. Mary's Health Clinics and the help she needed.
Okay, say, really big. Very good.
The medical staff at St. Mary's Health Clinic started Takara on a new treatment. Soon, she was able to breathe again without struggling.
How's your breathing machine going, huh? Do you like it?
Now, through St. Mary's Health Clinics, Takara gets all the medical care she needs, and the staff at St. Mary's delivers that care with something extra: dignity.
I'm going to blow the light out. Good.
I think most of them are volunteering their time, And there's not a lot of people in the world that would do that.
Well, Mom, I think she's doing really well.
They know that I don't have insurance, and that I can't afford it. They've always been very respectful and kind and gentle.
Today, Tara is in college studying for her teaching degree. She looks forward to a time when a job with full benefits allows her to stand on her own. But for now, she's grateful. Her daughter is breathing well, and thanks to St. Mary's Health Clinics, there is new hope for tomorrow.
Ready, Takara?
Okay.
Time to go.
Okay, time to go.
95% blockage, and that was in a main artery.
Diane Olson is lucky to be alive.
I was out blowing snow and shoveling snow, and it wasn't as easy, and it was very tiring.
She didn't know it at the time, but her life was in the balance, and she needed help fast.
Every now and then it would feel like your heart was turning somersaults.
For Diane, finding money for medical treatment seemed impossible.
I was between jobs, and to be able to maintain the benefits on their COBRA plan, it was like $795 a month.
Unable to afford insurance, Diane resisted getting the help she needed.
I didn't feel that there really were any options. I was more than willing to just kind of bite the bullet and ignore it.
But one day, on a visit to the employment office, Diane found a brochure for St. Mary's Health Clinics.
I was so relieved because now I can get some answers. Hopefully we can find out what is happening to me.
Diane made several visits to St. Mary's Health Clinics. There, her condition was evaluated, and she was referred to a hospital for more testing.
I did go in for the stress tests, and they did see that there was a problem there. And they suggested that I get into the hospital.
Doctors discovered the blockage to Diane's heart was very serious.
They thought that if I lasted the rest of the year, this is a week before Christmas, that I would be very fortunate.
Diane stayed in the hospital and received bypass surgery, an operation that saved her life. Today, with a healing heart, Diane counts her blessings. She has a good job and spends her free time enjoying the things she loves. For her, each moment is a new beginning and a chance to give thanks to those who helped in a time of need.
It's just a marvelous organization. And I'm living proof that it works. St. Mary's does it.
Bringing hope, touching lives, that's the mission of St. Mary's Health Clinics.
Our volunteers and staff are here because they want to be here, and they can see this beautiful, beautiful work unfolding every day right before their eyes. And it's all about our mission in that we are the hands of Christ, and we are reaching out to people in need.
If it wasn't for St. Mary's, I wouldn't be here.
These people are really life-saving people, so if you are in real need, they are always there to help you.
If St. Mary's wasn't there, I don't know what I would do. I love her so much. Seeing her well after all the struggles that we've had with the asthma, and being able to play and being healthy and just being able to enjoy things that other kids do, she just brings me so much joy. And I'll just be forever grateful.